Hi everyone, thanks for coming to my video. My name is Daniela, and last year around this time I made a few videos about nursing and nursing school, and once I got my job as a nurse I kind of lost track of time, I guess, and never made another video. I've had a lot of people message me on Instagram or follow me on Instagram or comment on my YouTube videos asking for more videos and asking a bunch of questions about my videos and stuff like that. So I decided I would sit down and make another. If you guys ever do want to see more videos, go ahead and comment about what you'd like to see, what you want me to talk about. I never thought I'd really need to make any more videos. I just didn't think anyone would really watch, but people have, so I think that's awesome. A little background if you haven't seen any of my videos. I graduated from nursing school in December of 2018. I was in an accelerated BSN program. I started working as a nurse on a med-surg/peds floor in May of 2019. So I've been working now on that floor for around 8 months. The topic that I kind of want to discuss in this video is if an accelerated BSN program prepared me to be a good nurse. So long story short is yes, it did prepare me to be a good nurse. I feel very competent compared to my coworkers and feel like I know what I'm talking about. I feel like I have the critical thinking skills that a nurse at my level of nursing should have, or at my experience level. I don't have all the answers like a lot of the older nurses do, but I think that's because they're older nurses. I don't think it has anything to do with the program that I was in. Some good things about an accelerated BSN program is that you have to teach yourself everything, which sucks, but it makes you really learn everything. So we had to, I talked about this before on another video, but to learn, we read those books from cover to cover. We didn't have a ton of PowerPoints and stuff to base everything off of. So if you didn't know something, it was really on you, and that is now reflected for me at work as a nurse. So with an accelerated BSN program, you only have a few days a week that you're at lab at school, and then other days you're in clinical or you're at home online doing homework. So the days that you are at school, you have to really pay attention in lab, or else you're gonna miss what they're trying to teach you. A lot of the time during lab, professors will just throw out little things and it'll stick in your head, and that will actually be a test question. And what's funny is sometimes things that arise at work, like who should be able to be, which patients should be able to be together in an isolation room and stuff like that, those were questions on our tests in nursing school. So if you really pay attention in school, a lot of these things are going to come back up. Things that you would have never really thought about again, they do come back up in work, and it's just funny to see that happen all over again. I will say I do feel prepared as a nurse for my accelerated BSN program, but I don't know if that's because it was the type of program that I did or if it was the school. Because we've had a lot of people tell students that I went to school with that they really like to hire nurses that came out of our school and stuff like that. So just from my experience, it was a good idea to do an accelerated. Oh no, I know. June. Anyway, so yeah, a lot of the hospitals around this area that I live in do like to hire nurses that came from my school. So it is kind of hard to say whether it is an ABSN program that prepared me or if it was my school specifically. But when it comes down to things, it's really about how well you study and how seriously you take school. Another thing that I think really helped me become a good nurse is the fact that my hospital had a really long orientation. I was on orientation for about 3 months, I think, and I had really good preceptors, and now I work with them and they still help me with whatever I need. So, and I don't know if I was just set up with good things, with a good school, with a good job, and a lot of people helping me, or if that program was really the way to go. Although I will say I don't think different programs, whether it be associates or anything like that. I don't think those programs really make the nurse that you are. It is all about you, yourself, to an extent. The one thing, which is not even related to an ABSN program, but the one thing that I will say that I think would have actually made me a better nurse would have been to be a CNA before I was a nurse. So I got my CNA license when I was younger, but I didn't use it really because I had gotten in a car accident. And I find that the nurses that were CNAs before they're nurses, just things can just click with them a little easier. Not necessarily on like a physiologic side, but more when it comes to like feelings, bonding with a patient. I'm a people person, so I don't really have that big of a problem with it. But you will find that the nurses that were CNAs before just kind of transition into their role a little bit easier. Also, things like bed baths, changing someone's brief, something like that, that does not come naturally to me. And I find myself like awkward with my hands when I need to do things like that. So I end up usually calling one of the CNAs to come help me with something because it just would take me longer to do it by myself. But if I had been an aide before, I'd probably just get it all done and leave it at that. I really think nurses should be CNAs before they become nurses. It would help because CNAs work so hard, and sometimes when we think they should just be able to drop things and do whatever we need them to, they're actually doing something really important on their own that will help us as the nurses do our job. So I think it would help a lot of nurses, me included, be a little more patient with the CNAs if we knew exactly what they were going through prior. I know this was kind of a short video, but I just wanted to make this video to kind of give a little explanation to a lot of the questions that I've been asked. I'd love to hear or read any comments that you guys have, and I can make another video or whatever it is. So thank you for watching and have a great day.